surroundings. Alright, I am filming the insertion of an NG tube. So what you would first want to do is check the physician's orders, make sure that they have an order in for an NG tube, gather your supplies, and then enter the room, introduce yourself, tell them what you're doing, and then identify the patient and then their date of birth. So then as you start, you would want to do a focused assessment of their GI and listening for the sounds, if there is sounds or if there isn't sounds, and then place their bed in high Fowlers, and then as you are doing this, place a drape across them to protect their clothing, provide an emesis basin and some tissues throughout the procedure. So then as you start, you would want to perform hand hygiene, don gloves, and get your tape ready. And then as you're doing this, you also want to get lubricant out and get your NG tube out as well. And then you can put your lubricant on this. Alright, so then you want to connect this, and as you're connecting this, you want to check the patient's nares to make sure that they're intact and they're looking okay. So then you want to measure from their nose to their earlobe and then the mouth to the xiphoid process. And as you find that location, you want to place a piece of tape, and then you want to instruct the patient to tilt their head backwards during this portion of the procedure, lubricate, and then you're going to place it in the nasopharynx, and then place it to the oropharynx, and then give them a breather, tilt their head forward, and give them water to drink as you do this. So then as you're doing the second part, as they swallow, you want to push it down, hand over hand, pressing it down until you get to the location that you taped. And at this time, you also want to check the back of their throat, making sure that it's not coiled and it's not in their mouth and it's actually down their throat. And so during this, you also want to just loosely secure it again to their face so it doesn't move. And then you also want to check placement of this. You can also do this with a chest x-ray, preferably, what normal doctors would prefer. And then you want to aspirate 20 milliliters of gastric juices and then place it in a pH reader to where it should be 1 to 4 to indicate gastric juices. And if it's not, you would want to take it out because it's not in the right place. So then as you do that, you want to secure it to your patient again. You want to make sure that they have enough room to look side to side and that they doesn't tug on their face every time they move, and that they have enough room. And you also want to secure it to their gown as well. So then you would also want to apply suction depending on what the doctor wanted it at. You would suction. And then you would perform hand hygiene again, clean up, and document your procedure. You would want to do your date, your time, the placement, your method that you use, the type of tubing, how many attempts, all that stuff.